Hey there, welcome back to another episode of GYNspirations. I am Dr. Oates. This is a space where we stop, we take a deep breath, we come with our hearts open, and we come ready to receive information and clarity when it comes to our bodies, and to receive that information with a side of inspiration. And maybe not a side, because that's kind of what I do, is inspire too. So welcome. If you recall, during the last episode, I shared with you all that I now have a 5-year-old, and Daniela is 5, but she's going on 25. And part of my motivation behind this space is that I don't want Daniela or her girlfriends, I don't want us getting our information from TikTok. I want us to get our information from trusted sources. So this is my attempt to bring that to you. And with that, I think it's important to start with the basics. One of the big questions that I hear probably at least once a day in my office is the question of, Dr. Oates, is this normal? And I actually love that question, because to me it means that that person is listening to their bodies and they're paying attention, and they're now starting to question what they've noticed. But one part of that question that I think that we have to be careful about is that it may invite the opportunity for comparison. And I am of the belief that our bodies are fearfully and wonderfully made. And that means that our bodies are unique to us. And therefore, I'd like to reframe that question. And the question I think that we should be asking ourselves is this normal for me? And so let's start there. In order for us to know what's normal for us, we have to first start paying attention to the patterns that are going on in our bodies. And our goal for paying attention is not to bring about fear. The goal is awareness. With that awareness, we're able to move forward in freedom. And so the first topic I want to talk about today is the topic of what is normal for a menstrual cycle. And when it comes to a menstrual cycle, there are 3 components that I think we should all be aware of individually. And if you've got pen and paper, which I think you should have out today, some of these talks will be like more where you can sit back and just receive, but today I want to challenge you to learn. And so if you've got pen and paper, the first thing I want you to write down is, what is normal for me when it comes to my menstrual cycle? And the first aspect of that is my menstrual frequency. Okay, you got that written down? The second aspect is my period duration. And when I say menstrual, that means period. They are interchangeable. So a period and a menstrual cycle are the same thing. So my menstrual frequency, my menstrual duration, and the last thing I want you to write down is my signs and symptoms. Okay? And so then let's go back up to the top and talk about what a normal menstrual frequency is. A normal period should last anywhere between 21 to 35 days. And if you notice, that is a range. And that is because we recognize in science that everybody is unique. Nobody is the same. And just because one person's body is a little bit different doesn't mean they're not normal. And so the way that we count our menstrual frequency is day 1 of one period. So the first day that you see blood and you actually have to change a pad, to the next month, or 2 months, or 3 months. And we're going to talk about that. PCOS is something that I love to talk about and I love to treat. If you're having periods once or twice a year or every 60 days, write it down. Don't let it scare you. Write it down. That's important information to know about your body. So between day 1 of one period and day 1 of the next period, what are the number of days in between? And that is how you will calculate your menstrual frequency. Now I've got an easy way to do that for you. If you're watching me right now, you're probably on your cell phone. So you can actually utilize the cell phone app. There are many of them, and I'm not going to promote any of them. You can use your Apple phone, your Samsung, different menstrual apps, and just put in day 1, and then each day thereafter, and then stop recording. And then the next time you have a period, put in that day 1. And that app over time will tell you what your frequency is. And my patients actually will hand me their phones when they say, I don't think my period is normal, Dr. Oates. And I'll say, do you track it? And I love it when they say yes. I love it when you say yes. And I take that phone and I look at the data and I actually say, look here. This actually says that you do have normal periods. Look here, your frequency is every 27 to 30 days, or your frequency is every 21 to 27 days. That's a normal frequency, okay? The next thing I want you to record is your cycle or your period duration. How long are you bleeding for? So between day 1 and day however, track that. A normal cycle or period duration should be anywhere between 3 and 7 days. If your period is lasting longer than 7 days, we are not moving in fear here. We are moving in awareness. Just write it down. Write it down so that you can share that with a trusted physician or a provider, okay? So that's your frequency, your menstrual duration. And the last thing I want you to start considering and paying attention to, and I think that this is so important, are the symptoms that you're having when you have your period. So our uterus is a muscle. And a dear patient of mine recently gave me this model in the office. And when she gave it to me, she had no idea that she was just confirming what God put on my heart anyway. Because I had said, I need a model to share on the on GYNspirations, but I have lots of models, but they usually are from a brand. And I didn't want to push brands on you all. So when she gave me this, I was like, okay, God, all right. You gave me what I wanted. I needed a model. I didn't even say it out loud. I thought it in my head, but here's my model. Thank you. You know who you are. So the uterus is a muscle. And so one of the common symptoms that we get every single month, even me, are cramps. So that muscle, when we're trying to shed the innermost lining, the endometrium, we talked about that last video. When that endometrium is trying to shed, the uterus actually has to contract to get the blood out into the vagina. And so that contraction brings about a pain. So pains are normal, but what is the severity of the pain? That's important. So if you're like me, and before having my surgery for my fibroids, you were chewing Motrin several times a day, you were on the floor in pain because your periods are so terrible, you may want to start paying attention. That is your body talking to you. If you notice that you're using pads or tampons, or a lot of you guys, my patients are now telling me about these menstrual panties and these diva cups that make lifestyle much better. But if you're using those things and you notice that you're changing your diva cup every 30 minutes, or you are having to change your menstrual underwear every hour, that may be a sign that you are having heavy bleeding. The other sign that I want you to pay attention to are the signs that you may have a low red blood cell count. So when we have loss of blood every single month, those red blood cells that we shed, those blood cells are actually responsible for carrying oxygen to places like our brain and our heart and the rest of our body. And so if we are losing red blood cells at a quick rate and our body is not able to replenish those red blood cells, we are suffering with anemia. And anemia is most commonly caused by our periods when a woman is having menstrual periods. And so if you notice that every single month when it's time for your period, You are tired. You can't keep it together. You can't focus at work. You are dizzy. You stand up and you feel like you're going to pass out. Or if you notice, a friend of mine recently told me, and now I ask her every single month, how was that trek up the hill? Because she noticed after she was diagnosed with fibroids that when she would walk up the hill from the train station during her period, she was short of breath. Those are signs of anemia. Write it down, okay? These are things that our body is communicating to us day to day, week to week, and month to month. And this is information that we should be sharing at some point with a trusted healthcare provider, okay? And so that brings me to something special that I've curated for this space. And it's been the way that I approach all things with my patients. I've curated it especially for you here at GYNspirations, and that is the freedom model. So one thing that my patients will tell you that I say probably every visit, besides stop apologizing, I feel like we as women, we're always saying, oh, I'm so sorry. I'm so sorry. My patients, I'm so sorry, doc. And I'll say, what are you sorry for? You have nothing to be sorry for. So outside of saying I'm sorry all of the time, stop doing that. Another thing that I'll tell them is that your body is always communicating with you. Your body is always talking. And it is so important for us to listen. You have got to listen to what your body is saying. And so the freedom model is something that I'm sharing with you right now. Here goes. This is just for GYNspiration. So the freedom model starts with the F, and that is to feel. We should be feeling and listening to what our body is trying to say to us. It's always communicating. You may be in a space where your body is telling you that it's at peace, which I've made some life decisions lately, and my body is telling me that it is at peace. And I love that for me. And if you're in that space, I love that for you. And if you're in a space like I was not too long ago, where your body is telling you that something is off and that you need to listen, I love that for you too, because I love that your body's talking, but I challenge you to listen. So the first part is to feel what it is that your body is communicating. The next aspect is to recognize, and that R component is to notice what may or may not be normal for you. And so to recognize any changes in the patterns that your body is showing you. You're noticing a headache, if you're noticing nausea and vomiting, if you're noticing diarrhea and constipation, recognize that that's a change in pattern for you or not, and take note of it. The next aspect is to educate. So now you know that there's something going on with your body, a change in pattern, and we do not walk in fear, we walk in awareness. And with that awareness comes the need to educate ourselves. And that's why I'm bringing you GYNspirations, because I want to be a source of trusted evidence-based information, there's a difference, for you, so that you are empowered to then advocate for yourself. You're going to educate yourself, and then you're going to open your mouth and you're going to speak. And when you open your mouth and you speak, there is power in your tongue, okay? So when you say, Dr. Oates, I have started to feel and recognize that there's a change, and I have done my research. I love to hear my patients say that. I have done my research, and I know that my period should not be lasting 15 days. Or I know that I should not be on the floor with the heating pad every single time I have my period. You are using the power of your tongue to say what it is that you're feeling and to get the help that you need. I recognize, though, that for some of you, you may not have a trusted physician or provider that you can share the symptoms and the signs that you're noticing in your body. And that's where I would challenge you to consider opening your mouth and sharing your symptoms with a trusted friend. There are so many women in my own practice who have found me from a girlfriend. It never fails. And I love them. There are so many women that will come to me and say, so-and-so told me to come to you, and that's why I'm here today. And so if you don't on your own have the resource or have not found anyone that you can trust, I dare you to have a little bit of faith and to open your mouth and talk to a family member or a coworker or a girlfriend. We're going to talk about the power of a good girlfriend, and to share your heart with her if she's trustworthy, if she's safe. There is power in connections and networks. So we're going to talk about that on another episode because that's on my heart as well, the power of a good girlfriend. But if you don't have a doctor that you can trust, try a girlfriend, try a coworker, try that sister who's walking in freedom and you're watching them live in freedom. You can have it too. Ask them who they see, ask them where they've gone, what they know, and see what you find out. Okay, so that's the express component. I want you to express yourself and use your words. Use the education that you have gleaned from this and many other trusted sites to say what's going on in your body. And the next aspect of the freedom model is the D, and that is then to decide. So when you come to your GYN visits, or when you've done your education and your research and you've come up with a list of things that you are experiencing and a list of different treatment options, you then have to make a decision. Many times in my office, I usually will have 3 different treatment options for my patients, depending on what they're experiencing. The first treatment option is oftentimes a medical management. The second one is oftentimes a surgical option. And the third option is one that we don't consider a lot, but it is always there. And that is the option to do absolutely nothing at all, to know that you have options, but to decide that you're not ready to proceed in any direction. Maybe the symptoms are not that bad yet. Making a decision is vital, even if the decision is to do nothing. It is not uncommon for patients to come to me for a second and a third opinion because someone else has pushed their recommendation on them. And then they come to me and I will give them their options and I don't push. I'll say, so what would you like to do? We are not here to push you. We are here to give you your options and to give suggestions and to share our hearts sometimes with you. Even within the 4 walls of a GYN office, I share my heart on a day-to-day basis. But the decision is ultimately yours. And I want to challenge you not to walk paralyzed in fear. It is okay to make a decision. And it is okay to trust that doctor or that provider if your gut tells you that they are worthy of your trust and that the options that they have presented to you make sense. Make a decision. And from there, we move on to the O, and that is the overcome of the freedom model. Once we made a decision, we overcome the obstacle, the issue, the symptom, and we then move in freedom. And that's the last aspect. That's the M of the freedom model, and that is moving in freedom. I want this for all of us. I practice this for myself, for my family, for my friends. I've got girlfriends right now that I can't wait to see what's on the other side of what we're experiencing together. I'm so grateful to be an advocate for my friends. I'm grateful to support you in this season of your life, to encourage you and to inspire you to advocate for yourself, to use your voice, to trust your body, to communicate its needs to you, and then to make a decision. I'm so grateful that you're here today. I think that this was needed. It's been on my heart. I didn't know how it was going to come out, but here it is. This is episode 4 of GYNspirations. I'm Dr. Oates. Thank you for being here. Remember that freedom in your body is your birthright, but having the faith that it can happen is what makes it possible. Have faith. See you soon.